Good morning and welcome to the Nursing Student Takeover. My name is Bree and today we're going to talk about all things nursing school, some nursing school hacks, time management and study tips, and clinical tips. Now, rather than do some long-winded introduction, I'm just going to start answering your questions and take you through my day. First things first, I want you guys to go follow me on Instagram at Nurse.org. I have so many helpful tips and funny little reels on there for you guys, so do that first. Question is, how long have you been in nursing school? I've been in nursing school for almost 4 years now. I'm a senior at a 4-year traditional BSN program at the University of Pennsylvania. Is a nursing student schedule like? It's much like today. You have class really early in the morning, 8:30 a.m. Then either like you have class all day or you have lab for a few hours and clinical. And then you're not at class, lab, clinical. You are studying or doing homework or doing care plans. So the life of a nursing student is very much so a grind, but we love it. Hey guys, so I just got back from class. I have about an hour break before I start clinical. So usually what I'll do is kind of like decompress, do some work, eat some breakfast, get my second cup of coffee, just kind of relax because then I have 8 hours of clinical. So in nursing school, you take core foundational classes like anatomy, pharmacology, pathophysiology, and you also take classes in all the nursing specialties like adult nursing, psychiatric nursing, women's health nursing, pediatric nursing, and other. And then in addition to those lecture style classes, you also do lab. So this is like skills lab. You learn nursing skills like injections, packing wounds, pulling out IVs. And then you also do sim lab where you actually pretend to be a nurse in a real scenario. And on top of that, you'll do real in-person clinical experiences. So these are at hospitals or other medical sites where you will actually practice delivering nursing care. You tend to like shadow a nurse and you have an instructor and they'll let you give meds, they'll let you do assessments. When it comes to deciding on a clinical site, first I like to look at all the options and see, okay, which hospital or which medical center is the best, which one is more nationally ranked. And then I look at the options of the individual floors that you can go on and I think, okay, which one is give me the most well-rounded and diverse experience. So for example, I'm going into a clinical next semester. I don't know where I'm placed yet, but I preferenced the emergency department because that's where you're going to get to see the most different things. Another thing I like to do is ask upperclassmen their advice, which clinical sites they liked, and even which instructors they like. Sometimes you don't get to pick a site, but you can pick an instructor. An instructor can really make or break your experience. I just want to think, which clinical site am I most interested in? Which one am I most drawn to? Also, don't pick something that feels super comfortable. Maybe like pick something that's going to be out of your comfort zone because that's where the most growth and learning is going to come. But unfortunately, sometimes you don't really get to pick and you just get assigned where you No, you do not get paid for clinical. Sometimes I make jokes that it's like free labor because we kind of are working as a little bit of a nurse. But these are my favorite experiences and my favorite things about nursing school. And this is really where you learn how to truly be a nurse. A lot of people have part-time jobs during nursing school. I'm personally an office assistant and a tutor. I find it very popular for nursing students to be CNAs or legitimately any part-time job that exists. I also recommend trying to like spend your summers making money because you have more free time. So my favorite study hack is to study like a Quizlet or read through my notes on the stationary bike or the treadmill because it's kind of a way where my body thinks I'm working out. It doesn't think I'm studying. So it kind of keeps me like more productive. I'll also wake up at like 5 or 6 a.m. on days that I'm really busy or have a lot to do because I just find that I'm super productive in the early morning hours because what else are you gonna do at 5 a.m. other than study? So that's another. Also just planning out your day, writing down every single thing that you need to do because there are so many things on your plate in nursing school. If you don't write stuff down, stuff will fall through the cracks and you'll get behind. But if you're able to write things down, manage your time, you'll be fine. My favorite thing I ever did at clinical was actually deliver a baby. That was my first day of clinical ever. So that was super awesome. And then I think my second favorite was putting in an NG tube. That was like a super cool skill that I didn't think I'd get to do in clinical. Unfortunately, you cannot become a nurse without a degree. You need either an associate's degree in nursing or a bachelor's in nursing. Some people that have associate's degrees right now are being required to get a bachelor's. So I would recommend a bachelor's degree. This depends on the type of program you're enrolled in. I'm enrolled in a 4-year BSN program, so I take all of the classes that I talked about earlier, but there's also accelerated programs that are about 1.5 years. But the caveat to that is you do have to take prerequisites, usually at a community college beforehand. For anatomy, I recommend using study guides, making flashcards, watching videos on things that you're not understanding. There's so many great YouTube videos out there, and using images to understand big concept things. And if you're really struggling, you should get a tutor. And if you're looking for a tutor, today's your lucky day because I'm an anatomy and physiology and pathophysiology and pharmacology tutor. So you can fill out this form, just swipe up, and we could talk about how I can help you. All right, guys, I'm going to take a little break from answering your questions because I have to go to clinical now. It's a virtual telehealth clinical. So yeah, I'll check back in a few hours. I am on break for clinical. The first part's telehealth, and then the second part I actually go in person to the hospital. So for the next hour or so, I'm going to answer some more questions. Favorite type of nursing is pediatrics. I love kids. I love working with kids. It's so rewarding. Children, you'll find, are super resilient. Yes, things can go downhill pretty fast, but these kids can bounce back, and it's super amazing to see. And I love kids. It also takes a very special person and a very special nurse to be a pediatric nurse. So I found pediatric nurses in that whole pediatric environment. All the staff is like super kind, supportive, and welcoming, and it's just an environment I feel like I also really liked labor and delivery. I was only on the labor and delivery floor for 1 day because COVID hit, but the time that I was there and I got to see a live birth, it was just so rewarding to be able to be a part of that experience. It's very popular for nurses who have summer breaks to do nursing externships or internships. That could be a research internship. I personally did one of those. Or it could be a nursing externship in a hospital where you're, kind of doing patient care and your supportive staff. But it is definitely not necessary. You don't need to have an internship or an externship to graduate or to get a job. You can have whatever kind of experience you want. You have your whole life to be a nurse. Having an internship or an externship is not going to make or break it. It will help, but how do you have free time in nursing school? This comes down to time management, planning out your day and being very disciplined and deliberate in how you spend each hour and making sure that you do set aside time for yourself. I can confidently say I probably have like 1 to 2 hours of free time every day. Also, free time for me is not just sitting around and staring at the wall. Free time for me is going to the gym, cooking for myself. I'm actually an actress and in some performing arts groups, so that's going to rehearsal. Free time is not watching Netflix, maybe it's reading for me, but this is the downside of nursing school, is it's not cheap. I don't know the best way to go about finding affordable programs. I think they're all kind of expensive across the board, but what you can do is you can research certain scholarships. There are like national and local scholarships that you can apply. So now it is time for my in-person part of the clinical where I actually go to the hospital. I'm in the emergency department for this clinical. And it's actually my last day, which is kind of crazy. This last day of the semester, the last day of clinical. But yeah, that's what I'm off to. It's my community nursing clinical. So what I'm doing is helping set up the families in the emergency room with resources in their community, like food, housing, medical supplies, etc. Hey guys, I'm on my way home from clinical. It was the last day, which was insane. Now I'm probably going to do a little homework and relax. I don't have any class tomorrow, which is nice. And I'll answer some other questions you guys had. All right, guys, this nursing student is going to go to bed. Thank you guys so much for tagging along with me. I had so much fun answering all your questions. Be sure to follow me on Instagram at Nurse.org. I post helpful tips and funny content. It was a blast, guys.